Nowadays, everyone wants to have a slim and fit body. Many people go as far as undergoing surgery to lose weight, while others try to control their diet, exercise, or even use medication to slim down. Will these methods really make you slimmer and improve your figure? By the end of this video, you'll know what happens after you lose weight and how you can address those changes. And will fixing those issues really make things better? Today we have the answers. Hello, I'm Associate Professor Dr. Pornthep Pungrasmi, a plastic surgeon from the BeContour team. We are a team of plastic surgeons specializing in breast and body contouring, and you're watching the channel Talk with a Surgeon by BeContour. In this video, we're going to talk about whether your body shape really improves after losing weight. Before we get started, don't forget to hit subscribe, like, share, and ring the bell so you won't miss out on great informative clips from the BeContour plastic surgery team. Many people who lose weight hope that their body shape will improve, that their figure will look better. This is usually true for people who haven't lost a lot of weight, but for those who have lost a significant amount, what we call massive weight loss, which means losing more than 50 pounds or over 23 kilograms, this can lead to changes in the fat layers and the skin. It results in excess and sagging skin all over the body, causing body contour deformities. And this brings about both physical and psychological problems. Physically, the sagging, folded skin makes it more difficult to maintain proper hygiene. This can lead to irritation, rashes, abrasions, and recurrent infections. There may also be back pain, neck pain, and shoulder pain from the weight of the excess skin, as well as impacts on mobility. Studies have shown that after weight loss surgery, nearly 80% of women feel that excess skin interferes with their movement. This causes nearly 50% of patients to not want to exercise anywhere at all. In addition, the development of body deformities also affects mental health, self-image, confidence, social relationships, and sexual health, all of which significantly impact quality of life and social participation. This is especially true for excess skin around the abdomen, arms, and thighs. Some patients, even after successfully losing weight, still avoid public activities such as swimming or exercising in public places. This is because they are afraid of being looked at or criticized. Moreover, the psychological effects also extend to sexual health. There are reports that patients with severe excess skin experience decreased sexual satisfaction and have a higher rate of avoiding sexual intercourse, even if they do not have any physical illness. Currently, the severity of body deformities is commonly classified according to the areas of excess skin and fat, divided into 10 regions: arms, chest, back, abdomen, flanks, buttocks, mons pubis, hips, outer thighs, and inner thighs. Most of these areas cannot recover or tighten on their own. No matter how much you exercise, there is no way to restore and tighten the skin back to its original state. Therefore, most treatment methods recommend surgically removing the excess sagging skin, and sometimes liposuction may also be necessary. Another question that often comes up is, after undergoing a body lift surgery, will your physical and mental condition improve? Most of the time, patients who have had a body lift and excess skin and fat removed experience a reduction in excess skin. They are able to exercise more effectively. This leads to weight stabilization, or in some cases, patients are able to lose even more weight. However, studies have shown that people who lose weight and then undergo a body lift to remove excess skin and fat have a lower rate of weight regain over 5 years compared to those who only lose weight without surgery. Without undergoing body lift surgery or significant removal of excess skin and fat. In addition, studies on the quality of life of people who have had body lift surgery to remove excess skin and fat show that they tend to have greater self-confidence and improved social interactions, and experience significantly improved sexual health as well. Moreover, they are able to maintain a high quality of life for many years, even up to a decade. As you can see, after losing weight, excess skin that sags and droops can affect both physical and mental health. However, undergoing surgery to lift and remove excess fat and skin can improve body shape. This leads to a clear improvement in both physical and mental health. Therefore, after losing weight and once your weight has stabilized, don't hesitate to consult a plastic surgeon to lift and contour your body to achieve the shape and proportions you desire. For those who are looking for information, seeking knowledge about plastic surgery, breast augmentation or breast lift procedures, breast reduction, breast correction, tummy tuck, arm lift, thigh lift or liposuction, don't forget to subscribe, like, and ring the bell so you won't miss out on great informative clips from the BeContour Plastic Surgery team. Please also follow the BeContour Plastic Surgery page by Pornthep Pungrasmi and visit our website at becontour.com. If you have any questions, feel free to ask or leave a comment.